Good morning, everyone. I am not Mark. I'm filling in for Mark. I'm Ann Spinard, and I would like to welcome you here to day 2 of our Home Health Quality Reporting Program provider training. It was amazing to watch the audience yesterday, to all of you, how engaged you were in all of the activities and the great questions that you had. And we hope that today we'll continue through that process and that we can answer most of your questions and that you're energized and can go back and have strategies to continue to educate, reinforce, and ensure the appropriate coding of the OASIS to have the appropriate outcomes. So today's agenda, we have a full day. So we are going to start off with the percent of patients with pressure ulcers that are new or worsened, the covariants, and we'll be looking at M1620, M1028, and M1060, and we'll have Ms. Kathy Roby, who will be teaching that, and you heard Kathy speak yesterday. Then we'll have a break, and then at 10:30, we are going to have the percent of patients with pressure ulcers that are new or worsened with the covariant GG0170C, and we will have Ann Olson, and I will introduce Ann shortly. And then we will have Kathy come back up and review the drug regimen review. And then we will take a break from lunch from 12:15 to 1:30. We'll come back. Kathy will finish up doing the drug review portion. We'll take another break, and then we're going to wrap up the day with a case study. And we have found that in our trainings, the case study kind of pulls everything together, and that's an interactive process at your tables that you'll work through. And Ann Olson will walk you through the case study, give you the opportunity to work that through at your tables, encode the sections of the OASIS that you need to, and then pull everyone back, and then we'll review the answers together. And then we will wrap up the day from 4 to 4:30 with additional Q&As that came in yesterday afternoon, yesterday by the end of the day, and any questions that come in throughout the day today. And that will allow us to give you most up-to-date answers to anything that we can land on and get through, depending on how many questions that there are. So today's presenters, I'm not going to present Kathy. You heard about Kathy's background yesterday, and Kathy, as we all know, and I fondly have known Kathy for a lot of years. She's a coworker of mine at Qualidigm, is always a very engaging speaker. But I do want to take an opportunity to introduce Ann Olson. And Ann Olson is a vice president and principal at Qualidigm, and I work very closely with Ann. She's over 30 years of management and strategic planning and business development and leadership experience, and all around a very, very knowledgeable person in home health care, and an amazing person and coworker. But prior to joining Qualidigm, Ms. Olson was CEO of Interim Healthcare of Hartford, and the home healthcare was the 5th largest licensed and Medicare certified agency in the country. In this role, she drove consistent quality and financial outcomes and led diversification through expansion to include licensed home hospice division, registered personal care and support division, and Ann brings this amazing depth of knowledge along with Kathy, and so we're very blessed at Qualidigm to have them as part of our team. Ann's a registered nurse with a Bachelor's of Science in Nursing from St. Salem College and is currently pursuing a healthcare MBA degree at the Malcolm Baldrige School of Business at Post University. And with me just finishing up my degree, Ann and I were usually commiserating that we had so much homework to do. But I'm done, so I'm happy. But she's continuing to work on her MBA. And so I think they bring real-life experience to all of you. They've walked in your shoes. They understand some of the struggles that some of these issues bring forward. So Ann will be presenting after Kathy today. So all training materials with answers will be posted on the Home Health Quality Reporting Program training page on the Centers for Medicare and Medicaid Services website. So that's been asked for a lot of us in between sessions. Because what we originally posted didn't have answers, right? And often didn't have the rationale. And so a lot of people have asked us, well, is that going to be available? And yes, it all will be available to you. After all of these trainings, these will be posted, and you can feel free to use those materials as is and do training and education. And the idea is kind of a train-the-trainer model. Or certainly it will give you an idea and a framework, and you can maybe plug in a patient or experience from your own agency that makes it then very relevant for your staff. Video recordings of today's presentations we posted on the CMS YouTube site. Again, if you found something particularly interesting, or you go back home and you're saying, well, what exactly was said? I need to really hear that again. Or staff members who couldn't make it to this training, you can advise them to go out to that YouTube channel, take an opportunity, and review it. So the idea is it's kind of enduring learning material. Certificates of completion will be provided and emailed to those attending in person today. And this training does not offer continuing education units. I did want to also just general information, just remind folks that the restrooms are out, straight out the doors, and to the left is the ladies' room, and I think the men's room, if we're doing that again today, I'm kind of looking around to see if that's what we're doing, is straight through the lobby, and I think it was to the right. There are people walking around today and yesterday with these nice yellow shirts that say Econometrica on them, and if you have any questions, or need help with anything, they are here to help. But certainly you could ask myself or some of the other speakers. We can certainly help facilitate and get you into the right direction and answer whatever questions that you have. There were some questions that came out around Q&A and where Q&A are posted. So I want to take the opportunity to just remind you that if you go out to the QTSO website, which is www.qtso.com/hhatrain.html. What you will see there is there are some quarterly Q&A postings, and there is a the OASIS C2 Q&A post from 10/2016, and as materials become available, they'll be posted there. But I also wanted to take the opportunity to let you know that there is a pretty comprehensive Q&A document that came out of the last training, home health training that we did, and that's at the home health QRP training page. And if you go to that page and you go down to the bottom of that page, to the download section, you'll see the Q&A document from November of 2016. And I think that was posted in March, this past March. So a lot of the questions that you may have or you want clarification, CMS has vetted those answers, and so that's available, and that's a lot about the types of training that we've done and the particular questions around wound care and a variety of things. So I would strongly encourage you to go out and download those, and we'll try to make sure that these are available and added into the slide deck so that people will have the links. I know it's hard to write them down when someone says them. So we'll just make sure that that is available to you, but those are some of the areas where you can get some of the Q&As and answers that are vetted from CMS. I do want to remind everyone that questions are very helpful. If you have the question, there's someone else who also has that question who hasn't gone to put pen to paper and or put that question into our electronic system. Please do so. All of the questions will ultimately be looked at and answered and then get posted. And so this also helps CMS understand where there might be potential training opportunities or opportunities to continue to educate, or where we must look at a variety of things, including policy and payment and whatnot. Not that this group is going to do it, but certainly it's just interesting to understand where people have questions and where they might be struggling. So for electronic question submission, you can click on this link. I think you all have it available to you. Make sure you enter your full name, organization, and email address. And then as you go through the submission process, using the drop-down menu, choose and select to which your question refers, and then enter the option item number, and then type your question and submit, and hit submit to send your question. Please, only one question per submission. We're dumping these all into a database, so if we have this very convoluted that has like maybe 5 questions within it, it can make it more difficult for us to be able to quickly sort them out, answer them, and get the answers back to you. And then, so if you enter one question and you're like, wait a minute, I got 5 questions, go ahead and submit 5 different questions to us. And you can do that by clicking Submit Another Response. So you don't have to put all that initial information in, it's already there for you. So we have a little bit of time this morning before we're going to jump right into our speakers. And we thought we would take an opportunity to have you do a little bit of work for the next 10 to 15 minutes at your table, probably 10 minutes, and then we'll bring the group back together and then talk. And what we wanted to do is have you sit at your tables, and if you're only 1 or 2, maybe you want to just move quickly over to another table to have a conversation. We'd like you to take out your action plans and or wherever else that you've been putting some notes, and we'd like you to talk about what thoughts you've had based off of this training, or interacting with other agencies, what you've talked over dinner as far as suggestions and ideas. What we want you to do is have this opportunity to share with other agencies, what have they done, stories and best practices for the OASIS C2 implementation, which started in January. So what's worked, what hasn't worked, what are your barriers, what are your successes? Because that type of networking and strategy, what one agency did, you may not have even thought about, and you're like, wow, why didn't I think of that? So this opportunity to share at a table is very, very helpful. With the challenges, if you have a particular challenge at your agency, toss it out to the group at your table. What if no one else has come up with that, maybe why not? And then what are some of the suggestions? A lot of experience in this room, so sharing amongst yourselves. Then what I'd like to do is, so we'll give you about 10 minutes, 12 minutes to do that. Then we'll maybe just see if there's any volunteers who just want to kind of share like an aha moment, or maybe what they think is a best practice, or maybe a barrier that they haven't come up with an answer to, and they can put it out as a challenge to the group to help them. And I would encourage you to use your action plans to maybe jot down some of these ideas, because when you leave here today, you're going to be like, what did Sally say? What was that she said, or what was the reference she went to, or what was that website? So take the opportunity to write those down. We'll ask people to just come up to the microphone, share, and then we'll get started at 9 o'clock promptly. So we'll give you, so we're about quarter of, so we'll give you about 10 minutes, 10 to 12 minutes, just at your tables if you will go ahead and share. Appreciate it. Okay, everyone, we'll pull this back together. So first off, thank you. The energy in this room went from this to whoop. I saw people move from tables where there's only 1 or 2 into larger groups. Some great conversation was going on. I think that's the value for a face-to-face training, is the opportunity to meet other providers. There's regional challenges, there's local challenges, there are national challenges as healthcare providers. And so the ability to share and to strategize and to network is amazing. I never walk away from any of these education or trainings or workshops without having a bunch of business cards. And I follow up with people to say, hey, that was a great strategy. Can we have an opportunity to kind of talk? And so I've had some really great support systems built out of some networking that have happened in trainings like this. So that being said, do we have any brave souls that want to just share with the group very briefly? We're only going to spend a couple of minutes on this. Either a lesson learned, what they think is a best practice, or something that just came up at their table that maybe you didn't have a solution to, and you want to put it out to the group. There's got to be a brave soul here. So people want to just maybe then toss out, and then I can repeat. What are some of the themes that you talked about at your tables? Anyone? Yep. Okay, so it was retention of staff. It's very hard to hold on to staff in the home health care setting. And so then that also puts up the challenge of how do you educate new staff coming in, right? So, did you come up with a solution? So, yeah. Okay. So what we heard here, I'm not sure if the whole group heard it, was that, you hire in the staff, you orient them, you get them into the field, and then they leave, that the regulations are getting harder and harder, the timelines, it's becoming more stringent, so it's a challenge. I think workforce stabilization in all of the healthcare settings is a challenge. I don't know if anyone has a solution. Does anyone have a silver bullet there, or a magic wand that they want to share? No? Okay. So maybe during some of your breaks or lunch, these are some of the topics you can talk about. What else? Anything else? Anyone else? Yep. I'm sorry. Did you hear it, Kath? Okay. I didn't hear it, sorry. Delayed paperwork. Oh, yeah. Getting the paperwork done. So, Kath, I don't know if you heard anything else that you want to...
Did you come up with any kind of ideas? The only recommendation I could give you is something that actually relates back to stabilization of staff. I recently did a training for the State of New Jersey Home Care Association, and we talked about employee retention and employee recruitment, and what we discovered in my discussions with the members of the association was that if you create an atmosphere, a culture in your organization where everyone believes that their prime directive is to do the best for the patient, and if my partner or the person covering me tonight, overnight, over the weekend doesn't have the paperwork, doesn't have the orders, my patient is at risk. It's buying into that as part of your company culture that makes a difference. And the employee recruitment and retention piece comes from enabling and encouraging your staff to practice to the maximum limit of their licensure so that they come to see that what they are doing truly makes a difference. That's the culture that you're trying to create so that existing staff mentor, partner, foster that in the newbies. And the newbies very quickly buy into that and realize that the rule is the rule for everybody here. It isn't different for you because the supervisor likes you better. You still have to get your paper in 48 hours. And we do it because we know that it makes our patients safer. Not because I said so, because everybody needs that information. So it's a suggestion, and I'm happy to talk about it further with anybody who wants to. But that is what we talked about, and agencies there that are using those practices are finding that it truly does help.
So culture is, as Kathy said, is critically important in any of the healthcare organizations, and I kind of like that idea of putting the patient at the center of it, because all of us went into, those of us that are nurses, hopefully went in for the right reasons, and we're a caring profession, and it's around doing the best thing possible. But there are challenges in each one of our healthcare settings, and paperwork, I think, is the one that everyone's complaining about. If we just didn't have the paperwork, right, if all we had to do was care for our patients, it would make it a little easier. All right, so we are actually at just a little past 9 o'clock. I would say if you could continue your conversations during your breaks, during lunch, go from table to table, start to talk to people, network, get business cards, continue the conversation via email and phone. This is a great opportunity. So thank you very much for being so engaged this morning, and I'm going to turn it over to Kathy, who's going to do percent of patients with pressure ulcers that are new and worsening. And Kathy, you are going on until 10:15, and then we'll take a break at 10:15. Thank you.